Sir, would you come and say a few words for all the India Hero Awards who have achieved their glory in different conferences across the world in the last 1 year? Dr. Harbanslal need no introduction.
Uh, Thanks to the institution like NN, Arvind, SN, LVPI, and many more who are really training our ophthalmologists well. And with the type of infrastructure they have created and the world class ophthalmologists we are producing, it was bound to happen. I remember during my residency day when we were in 80, 81, 82, 83, even the slit lamp used to be a luxury. I mean, the slit lamp was locked into the head of the department's room, and once in a while you will get the opportunity to go and see the on a slit lamp. And many of the people in a smaller medical colleges like गोरखपुर झांसी वो मुझसे कहते थे हमारा लगता है कि इनकी कोई अरविंद वालों से साठ गांठ है कि हमको सिखाते नहीं हैं so that we go and get trained over there. From that scenario to coming over here and being best in the world is actually a great moment for all of us. And with so many of you, I mean, it's unimaginable. Not one or two, but hundreds of them bringing laurels to the country. We are really proud of you, and three cheers to all of you and to the training institutions which are doing a great job.
So I have, it's ready. Some problem with the
Yeah.
They have to change. So we can start with the first awardee.
No, they're just having the initial slides.
Okay. Which we can keep moving this. I think in the interest of time, I think we'll have a few seconds for people. So in 2019, we have 65. 2020, we had 33. I mean, a big round of applause to these 33 actually, because this was a complete COVID year. So whatever they did was from the bedroom. And we had 49 Indian ophthalmologists who bagged the award at the International in 2021. Things started getting better. And this year, I think 2020, we have 61, right? Thank you. And I think we have just an hour here, so we'd like to start this program and request sir to be here. one request: when you become the president, sir, the hall is getting smaller and smaller. We are worried we'll less be doing in the corridor. If you can, we started off in a grand way. You see, one of our recipients was Dr. G.N. Rao. We're very scared to give him the award because he himself, but I think you had to do something about this. This is the pride of India, all the people here. And it's in these difficult situations of travel, going to meetings and self-funding themselves, going and winning is extremely difficult. So I think we request on behalf of all to probably give it in a different thing and not moving towards the corridors. You can see the halls then.
Sure, we will look into it. And any suggestion, I think people like you can really advise us how to go about. And we will definitely respect whatever your sentiments. And we'll request the chairman scientific committee, because he decides the halls and all, to look into it. Sure.
Thank you, sir.
Promise.
So we start with the alphabetical order. I would like to call upon. We can avoid the music, I think. This booklet, we can give it to everybody here.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले.
The first award is Dr. Aarti Heda for a video in Nepal, and won the best surgical video, and also she won a lot of money to buy a lot of stuff. So she's become rich, and winner of cataract surgery photo contest, interesting and artistic image category. So what was the photo on, Aarti?
So it was a normal photo, normal eye photo, which was taken through dry eye analyzer. So I showed photo of rings in the corner.
Okay.
Congratulations.
Thank you so much.
All the more success.
Thank you so much.
Our next awardee is Dr. Aditya Kelkar. Dr. Aditya, I think this is your third time? Second time. And he won the best award for the show. Just in few words, can you describe what was the video on? For a non-retina person also.
So this was a video which was presented at the American Society of Retina Specialists, and which won the Best of the Show award. And this was about a case which we managed. It's a recurrent optic disc pit, which was managed with a amniotic membrane patch graft. Thank you.
So one tip to all the new video makers. This is your third time?
This is the second time.
Second time. So one tip, apart from just video making and editing, which is technical stuff, how do you pick up the video which wins?
I think, to be very frank with you, the previous award which I got was Marfan syndrome, nucleus drop with a retinal detachment, which was nothing really very spectacular, but it was well documented, and it was presented in the most interesting manner. We could have a theme of Harry Potter's movie, and which made the film very interesting. So apart from just keeping the scientific aspect in mind, you also need to keep in mind that this is a film, so it has to be made more appreciative towards the audience so that they don't get bored.
So when you watch a movie, you always look at whether you can link this with some of your videos?
Absolutely, yes.
Very good. One of you hold this. One of you keep holding this, please. Dr. Ajinkya Vivek Rao Deshmukh. Be here. So Ajinkya Vivek Rao Deshmukh, from the same city as I come from, and won the second prize for the best presentation at the World Pediatric Ophthalmology Strabismus Congress 2021. And what was this paper on, Ajinkya? For
So
a
this was a paper on virtual bedside clinic in pediatric ophthalmology. Thanks to my mentor, Dr. Ramesh Kekunia, for coming up with this innovative idea in this pandemic time to, this was an innovation in teaching and learning. And we have submitted the paper to AIOC and it is accepted.
So
it should be out soon.
How does it really change the practice of bedside clinic?
So during pandemic, as we know, all the residents and fellows, their teaching were hampered. And so we conducted the virtual bedside clinic and broadcasted it all over the world through the online platform. And
You
then
still
we
continue?
evaluated its efficacy to the conventional bedside clinic. And most of our participants, they found that it is equally efficient as conventional bedside
So
clinic.
they will also be in the bed.
They would be on their own bed in their own place and attending the, all the cases which were being presented.
Still continue that? It's stopped.
It is still continuing.
All the
Yeah.
best.
Thank you.
Thank you.
so
God
much.
bless. It's my great pleasure to invite Dr. Ashwin Mohan. And he was my PhD student, and he did his PhD in retinal oximetry from Netherlands. One of the first PhDs I had to be with him during the defense, where it was an online one. So just give your experience about that online, multi-talented personality, now practicing, keeps changing the job. You have to figure out where you are now. So it's a big thing. The first oximetry PhD from Asia, actually, this is on retinal oximetry. Ashwin, quickly, apart from all the mathematics diagram you have done on that oximetry, can you let us know what was the thesis on and what was your biggest finding which you think can save the world?
The PhD was on retinal oximetry, and it was the first and the only machine that is there in India. It was a very interesting thing because when I started the PhD, it was about trying to find out what the changes in different diseases could be. But through our course, we actually identified a lot of artifacts, and my thesis ended up actually establishing that the machine is not very reliable for scientific conclusions. And it stood out because it is ours is the only group in the world who have been so vocal about saying that the machine still needs, the technology still needs a lot of improvement. So
No, I don't. Thank you, Ashwin. So what is next? How do you want to apply this? Want to build a new machine?
yes.
Oh, thank you. My honor to invite Dr. Anil Kumar Mandal. Yeah, I will. International guest speaker, many things. You can please read. Which was your favorite, sir, of all this year?
The most important thing is over the last 31 years in LB Prasad Eye Institute, we are practicing holistic care for management of children with congenital glaucoma. Holistic means including medical, surgical, genetic and rehabilitation approach. In 31 years, 7 of my operated children are doing medicine, 5 are postgraduate medicine, and 13 dentistry, practicing dentistry, and 5 PhD, and so many children are doing, teacher, engineer, lawyer, journalism, etc. It's a very interesting journey. I want to continue. I want to see some of my operated child will come in ophthalmology. Let us see.
And will operate upon your eyes when you develop cataract.
Thank you, sir. Dr. Anirudh Agarwal. Again, this is your second, first, fantastic. First of the many to come. So he's won the ASRS award 2021. Was this a virtual or a physical one? Same as Aditya. So what's your what's your 3 points for making a good video? And 3 points, forget, he told about 3 points you have to avoid if you want to make a good video. Avoid.
I think Dr. Kelkar has already summarized, but you have to focus on the scientific content.
Anirudh, I said 3 points you have to avoid.
Yes. So don't focus primarily on just entertainment. The other thing you have to avoid is excessive animations, excessive, flowery video. And probably the third thing you can avoid is, digressing from the topic. So don't just stick to the main, main aim of your video, and I think that will fetch you the award.
What was your video on?
My video was on a difficult case actually. It was a retinal angioma, excision of retinal angioma with pars plana vitrectomy, along with a retinal detachment. So
how did you plan making this video, incorporating the other non-medical stuff into it?
Yes, because this patient had a lot of systemic association. So we spent a lot of time in collecting all the data from all the other specialities, and of course the surgery itself. So a lot went into it. So thankfully we could gain recognition for it.
Thank you, and we'll see you more often.
Thank you, sir.
Dr. Ankita Aishwarya, right? That's what it's. Or Dr. Anirudh is here? Yes, please. Ankita, just 2 minutes. Oh, she's already there. Please. She's woken up the baby. I think this is a very special award. Give it to the baby or giving it to the baby. So what was your paper on?
So it was super selective triple drug IAC on retinoblastoma.
So how do you think this paper which you won is going to change the way you practice retinoblastoma practice? There are so many other retinoblastoma colleagues also here. Why do you think Dr. Fairoz will adopt your technique over what she is doing?
So the first thing is very safe and effective. Ma'am, it's very safe and effective. Only 3 cycles are needed and at much lower dose. So the side effects are very less and results are very fast and very good.
Thank you. All the best. So I'd like to call upon Anirudh. Congratulations, sir. Received the American Society of Retinal Specialists Fellowship, Society Fellowship 2022. So there are a lot of retinal colleagues here, and how do you get this? Apart from the good work and other things you're doing, how do you apply for this? Who gives you? So if you can just...
nothing significant like consistent work and consistent presentations to the conference of ASRS. Also active participation in their many programs that occur throughout the year. And after around 5 to 6 years of consistent work, they see everything, that is what you are practicing, how you are publishing, presenting, everything, and then they give the fellowship. So nothing special. If you keep working in your field and if you keep doing presentation and publication, then it is done.
Thank you, sir. Dr. Anishka. She's here, yeah. Dr. Anishka won the best award in International Conference of APVRS at 14th Congress. I think a lot of Retina Congress videos, I think. Dr. Anishka, anything you want to add on the videos? What video you have made? And
That video is about using a smartphone as a microscope, using which you can practice your few surgical skills like suturing, capsular access, even at your home.
Is this video freely available for people to download and use
Yes, sir, it is available in YouTube.
Okay, where do they search for?
They can search it using AIOS, sir. In innovation, that video got selected. So if you put AIOS innovation as a video, you can find it.
Thank you.
Thank you.
Dr. Arvind Kumar. Dr. Arvind Kumar Moria is here. He'll come late. Dr. Ashok Vardhan. So late. He's not here. Dr. Bhavya. So Dr. Bhavya won the second prize for Young Ophthalmologist Symposium of EPAU, and she represented RO and also got the travel grant and the paper presentation at RO 2022. So Dr. Bhavya, you're quickly on your second prize for the best presentation. Which is your favorite, RO or the first one? Okay, you tell the RO. So what did you do in RO? This is your first RO as a MSc.
So the first thing I want to highlight is I represent my team. My work I presented at RO is actually on mucormycosis, ROCM pandemic when it happened during second wave of COVID. So the entire work happened over only 2 months. So when I see the other presentations in RO, they're presenting their thesis work, which we did for 3 years, 4 years. But the entire work we presented had been done in only 2 months. So all our oculoplasty surgeons, the lab professionals, everybody, they dared their lives to go to these ROCM patients. They collected the samples quickly. They took the COVID
But what did
samples.
you find? What did you find in those samples, which were very specific, which got you this award?
Yes. So we gave a predictive marker, basically the NK cells. So just by doing a blood count, we can tell that which of the COVID patient is at high risk of getting ROCM. So if someone walks to your clinic with COVID, they ask you, will I get ROCM? We gave a predictive marker that yes,
Fantastic.
you are at high risk of this.
Thank you. Dr. Dharmesh Kar is here. Yes. Again, he got the fellowship of American Society of Retinal Specialists 2022. Dr. Dharmesh, if I ask you this question, Dr. Dharmesh, what do you think was the one major factor why you got this selected in this one factor in you?
Continuous academic involvement
Fantastic.
in the retinal field helped me to get this fellowship.
Thank you.
Sure. Thank you.
Dr. Fairoz? A lot of your... Leslie is your biggest fan. So she won the Best Poster Award in AO, and Fairoz, little tough question for you. What did you work on, and how do you think Ankita's child, when she becomes an oculoplasty surgeon, is going to use this concept in a different way?
Okay. I'm sorry, the topic is not here.
Yeah,
So
even I don't have the topic.
Oh, it was given. So it is basically a long-term survival on orbital retinoblastoma kids who receive the multimodal treatment protocol. So what Ankita spoke was salvage of eyes, where we were talking about orbital retinoblastoma, which has a very bad, poor prognosis as far as life is concerned. So we were kind of salvaging the life.
So how do you think in next 20 years, what you did
Yeah.
is going to be a game changer?
Well, so it has already been a game changer because it's been very, very difficult, especially for less developed countries in Asia, where the advanced disease come to us. So this is actually the proposal of a multimodal treatment protocol, and it has actually changed. It has been a game changer. I would give the credit to my mentor, Dr. Honavar, also, who had initially put forward the treatment modality, and everyone in India and abroad, like Africa, Southern America, and other places where the treatment has been, the disease has been presenting advanced as orbital retinoblastoma, is currently under use. So yeah, the results are being
The
out.
second question is 70% of this crowd is young women. You are in the top 100 women ophthalmologists 2021. All of them would want to be in that. Give them 3 quick things why Ritika should be in that when she turns 40. Now she's 20.
I think all of you should be there. If I can be there, I'm sure everyone can be there. And I think
3 things she needs to know.
consistency, attention to detail, and a lot of hard work. Nothing comes easy. There is a lot of midnight oil that you have to burn, but at the end of it, it's all worth it. And so again, it's your priority, what gives you happiness, and this gives a lot of kick for me to do better. And I ask feedback whether after every presentation or whatever. I definitely take feedback from my mentors and even my students whether I have done well. So there is always a scope of improvement. So keep improving and doing well. And I think women are with lots of talents. They are multitaskers. You have a lot of abilities in you. Capture it. Thank you so much.
So the last thing, this is your 3rd time or the 4th?
Third time, actually.
We'll see you more
yes.
often. Thank you.
Thank you so much.
And you're the voice of this room to the scientific committee for the better room.
I know. I feel embarrassed to see this.
Yes,
Yeah,
so you are the... Yeah. Thank you. Dr. Gairik Kundu. Dr. Gairik is doing his PhD also in AI, and he's got the travel grant and highest mark secured for the paper submitted in AIOC2022. And so Gairik, quickly about, how much do you think we are using AI in ophthalmic practice today?
I think the challenge or the limitations in the initial AI projects were all related to imaging and symmetry in imaging. Unfortunately, because of the fact that data and extrapolating raw data into AI, especially in anti-segment imaging, is kind of tedious. So it takes years to rather build a good data set. I think once we overcome that initial mental block that, AI is actually, like I say, AI is not future, artificial intelligence is the present. And
the question is, do you think that a wrong set of data fed will make it start thinking differently?
Well, it can rather confuse it. Exactly. And therefore, understanding, giving the AI what you want it to, predict correctly is very important. So more than running the AI, the data building and the extrapolation and utilizing that for machine learning is very important.
Fantastic. Thank you, Gairik. Dr. Gairik is doing his PhD on the same subject. Dr. Gaurav Garg, your mentors should have been here, all 3 of you. Any more? So I think it's a fantastic moment to see all of you winning so well. And e-poster at EPAW and best free paper in APVRS 2021. So Gaurav, anything you want to add on these 2 papers?
The first one I won as an e-poster for the OSSN study, invasive OSSN plaque brachytherapy. And the second one, the APVRS free paper, was an international study I did under my another mentor, Dr. Polty Finger from US. So that was the thing. That's it.
Fantastic. So how do you want to take this forward now that you won a paper? Forget about publications. What do you want to do in this paper? Let's say in the next 5 years, if you have to come back again and present, what do you see different in this paper?
So first, I'll talk about the APVRS free paper. So that paper was choroidal melanoma metastasis. So the motto behind that paper was, the study was done in 2001 to 2010, and they have given the AGCC 8th edition classification. So now we are going ahead with the 9th edition. Soon it's going to come up. So the motto was to see the metastatic risk factors, what are the things at presentation. We saw even T1 is having the metastatic risk factor in the choroidal melanoma. And now the second paper I have come up with, it's a lesson learned from those, the previous paper.
Thank you. Dr. Gaura Chattanavar. It's not here. Okay. So Zai Kelkar, you can bring. So Aditya is here. Okay. I think it's the first time husband and wife getting this. Big round of applause for this. She got the award, the FRC Opta in 2021 Achievement Award, the FSCS American College Surgeons degree in 2019. What was the toughest part of preparing for FRCS Opta? Why did you choose this? Of course, it's a degree, but
I gave my FRCS when I turned 40 because after our medical education, I started feeling that am I forgetting things? Am I really up to it? Our hospital got international accreditations in the form of JCI, and I thought my degrees also should have an international accreditation. So I did FRCS. And after FRCS, I thought might as well try FRC Opt, and then I gave it.
FRC Opta has the one section which I was really scared of was the refraction part of it. All that, do you think still it's the same?
It is still the
We're
same.
so
and
used
yes.
of autorefractometer, but they're still with the Jackson
But
thing.
that's maybe because I'm a pediatric ophthalmologist. We cannot rely on the autoref for the kids, and streak retinoscope comes to help, and that helped me in the exam.
So that means age is no barrier.
Age is not a barrier.
So
I'm still young.
so I know. For people who want to take up exam, this is a very nice point you brought in. That after some time you need to see whether you need to be updated like ISI, what is that, NABH and all that.
Yes, yeah.
So you take up a degree exam. Yes. Did you feel difficult to go back as a student and answer those questions?
No, more the fear of failure is more. I hadn't told anybody. My mother always used me. She knew, of course. She said that don't worry, nobody knows. But I always told her, but I know.
But the examiners also know you know.
Yeah, examiners knew me.
I think. Thank you. This was really inspirational. Dr. Jaspreet Sukija is not here. It's always a pleasure to call John Davis because we meet all the time here in this platform. And big round of applause. This is your fourth? Second.
Last year was my wife.
Oh. But you still counted as half. Because she gave a lot of credit to you. So, John has many things, but Best Video Award in the APVRS 2021. I think we should ask them to sit on the other side. John, what video was this?
So this was Kitchen Ophthalmic Surgeon. This was a product of the pandemic and lockdown. My wife was planning to join a fellowship, but unfortunately, COVID struck. She joined in March 2020. March 2020, towards the end, was when the lockdown happened. So everything went down. Then she got pregnant. So she discontinued the fellowship, and she had to join back and do the complete fellowship again. So this was that when at the time when she discontinued the fellowship, she was back to the kitchen, so to speak. So kitchen ophthalmic surgeon is practicing eye surgeries in the kitchen, tomato, potato, all those things. The video is there on YouTube. Just search for kitchen ophthalmic surgeon. It was very fun to make this video. My son is also there, and my daughter is there.
Yeah, I've seen that video. It's quite interesting. Is the kitchen still running for the next video?
We will make more videos.
Thank you, John. I'd like to call upon K. Veena. Is she here? Anybody from this organization? I don't know. Because it's a... You're Veena? Oh, very good. Because it's a very important video because it was the best of best. Winner at ASCRS, young new producer, young physician. I think it's big round of applause. And for all the mentors and everybody, because it's very difficult to get this. Sorry. Again, very, very happy to announce this name. From the time this session we're conducting this, Lionel Raj has been, we've grown older with this session. And he's become a professor also. So, Lionel, what new this time?
These are not new. The new one is not mentioned. I played for India in Badminton World Championships in Spain.
Oh, fantastic. We're extremely proud. I mean, for a lot of people who are first-timers and all that, it just shows, Lionel just shows the power of dedication. And it's so consistent, not just in the category, it's all meetings, sometimes in APSCRS, ESCRS, American Academy. I think that's really been the power of what you're doing. And it's been a really, really inspiring to be associated with you for the last 7 years now and being part of this award ceremony. I think all the best. I'm sure you're going to be here
next time also. Yes.
Next time also.
Yes.
Thank you. Thank you. A round of applause for him. Good friend, Dr. Madhu. And this is your fourth time, yes. International Education Award 2021. Because of COVID, the slide is less busy. Otherwise, the slide is very busy with many, many things. Very good innovator, cornea surgeon. Thank you. Dr. Muralidhar Ramappa. Best Show Award 2021, Best Poster Award, AO. Fantastic, very, very difficult to get a paper accepted or poster accepted in AO, and Dr. Murli has really made us proud by winning. So, Dr. Murli, just quick things about these two things. You work on one of India's biggest expert on rare eye diseases and many other things, but were they part of the rare eye diseases, genetics?
No, Dr. Rohit. Thank you. Thank you once again. It was actually a new technique called a SEPA, selective endothelectomy in a Peters anomaly. So we have innovated, pioneered this particular technique. So the Peters can be now treated with a SEPA, not keratoplasty. So it is a one-time single surgery for the lifetime.
That was your Best of Show award, is it?
Yes, Best of the Show
And
award.
the poster was?
The poster was, again, lamellar surgery in a pediatric age group.
Okay. Fantastic. Right. Wish you all the best, sir.
Thank you, sir.
Dr. Narendra Babu Kannan is here. Best video at the Asia Pacific Retinal Society Congress 2021. Sir, just a few words about your video.
Actually, nobody should do this surgery because it's a management of complication due to intravitreal injection. The patient had a rib which was managed surgically, but the outcome was good in this case. but nobody should do because
If you
no
can just
patient.
quickly give a tip, what the surgeon should not do, which you explained.
No, that is not in our hand because we have injected anti-VEGF because of the taut RP. It went in for a rip and involving the macula. So the patient came with 6/6 vision, dropped to 560. After surgical management, we could restore 618. But I hope nobody should get this complication.
Thank you, sir. Like Lionel Raj, one more permanent resident of this award is Dr. Pooja Kamar. And you have, sir, please come. Her uncle, who's a pioneered senior retinal researcher. Please come, sir. You can be with her. And you can take the award from him and so both of them. So she's a Trotman awardee at AIO, Best Paper Achievement Award, and she's kept the other 3 for next year, I guess. So, 1 minute. So this is your what? You and Lionel are matching with each other. So from the time it started to now.
Yes.
So for a lot of youngsters here, what do you say, for example, Dr. Supriya is here. She wants to get a Trotman. What is the thing she has to do today so that she gets Trotman in 2026, 2027?
So you need to work on a unique concept which has never been done before. And then you need to choose Journal of Refractive Surgery, JRS, as the journal to publish as the first author or the corresponding author. So if your paper is chosen as the best in that journal, then you get the Trotman Award for that paper. So all the best.
So a lot of youngsters, I'm just use one name here. It can be for anybody.
Yes.
So best part is Trotman Award is one of the most prestigious award in AO for the refractive surgery section. Why? Because all other awards is given as like this. Trotman is the only one we get 30 minutes to speak in front of 5,000 odd people. I don't think that can be anything better than sharing your work in 30 minutes in front of everybody and then you get an award. Because it's for a young award and before you all turn 40, I think, right?
Yes, before 35.
Yeah, before 35.
Yes.
They change the age also. So a lot of people, you can start looking at that and focus on it. And if you get that, you can't get, and I have not got it, but some of us were there. The feel of presenting in a 5,000 or big hall is something different. All the best. And she also have created the record of winning the best paper in ESCRS 4 times. Again, this year, she had done it in 2018 and to 19, I think. And again, but that I think will be next year you'll get this.
Thank you. Thank you, everyone. Thank you.
We missed Dr. Arvind Moria, so he's already here, so we'll just finish it. Yeah. All these things, reason we need this award is not about clapping, it's about to inspire people because this is filled with young people, I think. Dr. Arvind won the award for study published on clinical study in ophthalmic star awards during ESCRS 2021. Arvind is a very dynamic person, very enthusiastic in many things, and great teacher. So Dr. Arvind, what was this paper on which got you this award?
Well, Dr. Rohit, the idea was to replace this IDX-DR. The problem with IDX-DR is no body shaming. It's very bulky. It still has a very high maintenance. So we have this same referral system on a smartphone. So it's leaner, it's meaner, and it's thinner. Thank you.
Thank you, sir.
And we completed this annotation tool with the data of more than 2 lakh and 32 centers across India.
Thank you, sir. See you next year. Dr. Pranjal Mishra, best paper. Pranjal Mishra is here. Dr. Pranjal Mishra won the best free paper APVRS 2021. Pranjal, something about this award? Where are you from? Where are you working? And what's your passion? What got you this paper?
So first I would like to thank Dr. Anand Vinekar sir for involving me for this study. So right now I'm in Raipur, working in a government medical college. And this paper was about basically choroidal vascular index in the patients who come, the kids basically. We diagnose as a CVI later on. So those patients, if you want to screen before.
Basically
so
working on cortical vision blindness.
Yes, sir.
Okay.
Cortical vision blindness.
Thank you. Thank you.
Thank you so much, sir. Thank you.
Dr. Prasanna Ramesh. Okay. Dr. Prithvi Chandrakant, come in, please. So Prithvi won the best paper of WWCRS award and the award for AIOS Innovation Forum 2021. What is the full form? Prithvi, what's the full form of WWCRS?
World Webinar of Cataract
Okay,
Refractive Surgery.
That was on the. So what was your video on?
My video was on frugal ophthalmic imaging. Without a slit lamp, I was able to diagnose a small worm, that is ophthalmomyiasis externa, with just using a smartphone and an
I
IOL
just saw your
attachment.
poster, right?
Yeah.
You can show them that phone had that thing.
Yeah.
I just visited his
Yeah.
poster.
This is basically my entry segment and microscope I carry out around with in my pocket. So my slit lamp and microscope is here. So I just need to fix it with the camera, and then I do the same thing which everybody does in the hospital.
If you go down to the posters room, he has a very nice poster which explains a lot of photographs. I did visit him in the morning. Thank you, Prasanna. Dr. Priyanka Sate. She won the best paper at the American Society of Cataract Refractive Surgeon 2022. And this is a first time winner. All first time attending conference, first time going to US, and first time winning. So what do you think was the one reason quickly which got you this paper, which made you to win this paper, apart from the work?
I think this work was very futuristic. It spoke for itself.
Just give the title of the paper also.
Yeah, so the title of the paper was Prediction of High-Risk Demographic Factors in Keratoconus Using Artificial Intelligence. So basically, we used an AI model. The first AI model predicted progression and differentiated that from a stable KC. The second one used the output from the first AI model as the input for itself. And in the second one, we amalgamated different various risk factors associated with KC, and we are trying to basically it has shown really good accuracy. So that is how we'll probably.
What did AI pick up as?
I'm sorry, sir.
What did AI pick up as the most important factors for progression?
The most important was immunoglobulin E, followed by vitamin D and allergy, systemic allergy.
Thank you.
Thank you. Thank you.
Dr. Purvi Bhagat. The winner of the e-poster for poster presentation, Certificate of Appreciation by AFS International Program US. So, ma'am, the second one, what was this intercultural programs? What?
Yeah, actually, it's an organization that is AFS, that is American Field Service. So it basically deals with exchange programs across borders. And it includes all students and professionals alike. So it helps to understand each other's education system, the healthcare scenario, culture, diversity, everything. So this was especially more important because it happened virtually. The entire program happened virtually.
Congrats, ma'am. Thank you.
A suggestion, if I can make, if we could change the ophthalmic heroes to gender-free stars or something like that.
He's the president. Dr. Rashmi Krishnamurthy, she's here. Rashmi is not here. Anybody from the on that center? From LV Prasad, she won the best prize at the 9th World Glaucoma. Is collecting on his behalf, I think. Wish her all the best. Dr. Reshma. Come in the center, please. She won the overall best of best papers at ASCRS 2022. None of us knew there is something called best of best ASCRS. We had... she says you didn't get the picture. Don't blame him afterwards. So, it was interesting that we had 4 of our fellows going there, 4 or 5 of us. All of them won best paper. She was the only one who did not get. And she was quite upset about it. When you go for the first time, you always like to see. But on her birthday, at exactly at 12:15, she gets a mail that your paper has been, I believe they collect all the marks. And this paper, they select 4 papers in ASCRS, which gets the best overall marks of all the winners. And this is one of the papers of this. I've not heard of it before. The best paper of the entire ASCRS section. So, how does it feel not to get something and suddenly out of blue on a birthday you get it? I know you start believing in God more, but apart from that.
It was amazing. I mean, I was just sitting, it was my birthday and I was just sitting and then the mail comes and I was like, am I dreaming or something? Is this really happening? So yeah, it is brilliant when your work gets recognized. And it's a team which works and it's a team which wins the award.
Thank you. It's nice to be one of the 4 in this year ASCRS who got that. Is like 4 people getting Rangachari Award. Reshma, you're making him difficult. Thank you. So I have Dr. Ritika here. She's come with her parents from Uttar Pradesh. They're both doctors. Call them here, please. Their support was very important. So she has a lot of award this year. Film Festival Award, first prize, a lot of stuff. Paper presentation. Physician himself in Lucknow.
We are very proud of Ritika. I am a physician. I always thought she may be following in my footsteps, but she has struck out on her own and it has paid dividends. Congratulations to her and I'm very proud of her.
Thank you. Ritika, anything you want to say? This is your 2nd or 3rd? She was complete COVID batch but still kept winning awards.
So all thanks to sir and our team behind it. Also Dr. Pooja, who I irritated all throughout my fellowship, and every video, every paper has her hand in it. And so my video is more special to me. I actually like all 3 of my awards. But so I started in the first week of my fellowship on the novel toolkit. And we did have a lot of rejections on that with sir. But we completed that. We saw the COVID going on to 2020, 2021 initial year. But then I got a mail for the virtual ASCRS that we had won on that same video. So it was a very surprising and a very proud moment. Thank you.
So, Ritika, nice suggestion he said. It's nice when you introduce yourself, just introduce where you're from and she is now in Lucknow. So, she's a trained cornea surgeon, cornea refractive and cataract surgeon. she will build it in near future.
So I'll be joining an institute. I'll be joining Dr. Rajesh Bhatia at Chandra Eye Care, and I'll be heading their department of cornea, ocular surface, and keratoconus. Thank you.
Dr. Ronal. Dr. Ronal has Achievement Award of Asia Pacific Academy of 2021. Wait, she's given a camera there. So, sir, where are you from? And I mean, what do you think made you to deserve this achievement award? So, if you can.
Basically, I'm from Manipur, from Imphal. And for the last 15 years, I was working at Sri Shankardev Netralaya, Guwahati, as a senior consultant in vitro retina department. But unluckily, I left the hospital last year only. And I'm preparing my own hospital in Imphal area.
Thank you, sir.
And I hope this award is the easiest award to get, I think. But only thing is you have to present in the form of papers, free papers, and a poster and videos.
This is not easy, sir. You have to consistently present.
Yeah, you have to present.
There is
and
a,
minimum
there is a
4
scoring
years.
system for that.
4 years, minimum 4 years is required.
And every paper, every poster has a scoring system.
Yeah. So if you present more papers, you won't get marks, points. So, okay, thank you.
Thank you, sir. Thank you. Dr. Sahil Agarwal. Dr. Sahil Agarwal won the best IYK International Ophthalmology Contest by the American Academy 2021. Dr. Sahil, where are you from? What is your area of work, and what did you win in this?
So right now I'm working as a research associate at Dr. R.P. Center Ames. I had done my junior residency and senior residency from there. So this was a comprehensive collection on various imagings, all type of imaging, in fact, that you can see in a walk-in oculoplastic clinic throughout my 3 years of residency that I had done. So
fantastic.
Thank you.
Thank you. All the best. Dr. Saili. You're lucky madam is here to give the award for you. Dr. Saili won the best video at the APAO 2021. Ma'am, you got one extra photographer also. So, Saili just finishing her fellowship with us, and she will be going to which place?
Kolhapur.
Kolhapur to set up her own practice. So, what was this video on? Quickly.
So, first of all, I would like AIOC to thank you, AIOC, for recognizing and celebrating this award. So, as my colleagues have said, that this award, it's just a representation of what all hard work we are doing at our institute, and it's a complete teamwork. My topic, the video topic was topographic removal of epithelium in keratoconus followed by a collagen cross-linking.
Thank you, Saili, and
thank you, sir.
Wish to see you more often. We have Dr. Saili again, Shirodkar. So she has won the best paper, then also she's the best video. I think she's using it for the next year. Best video at the ASCRS and the best paper again. Come. She's doing a fellowship with us at this point. Saili. Fantastic. This.
You should preserve this. It's a very nicely designed certificate. Very, very nicely designed. And we should thank Ashok and Rohit Shetty for all this.
No. Ashok only designs.
Yeah. No, not for this. I'm talking about the entire program. And yeah, because it took 3-4 months for me to finalize this certificate.
Yes.
Because it took a couple of months to design this certificate, and it's a much neater certificate, which ultimately he agreed to sponsor this. Thank you. Yeah. Thank you.
So, Dr. Saili, this particular video has won twice and the paper twice.
Yes, sir.
And can you just very briefly discuss about this, because this has a very good clinical applications on this particular subject. I think you have not added the other 3. You're keeping it for next year.
So this study was actually a very novel modification of a very conventional technique where we used thermotherapy in the form of cold therapy to reduce post-operative pain in PRK patients. And the manner in which we approached it was very novel. And it started off as a simple, just sir telling me in the OT, just record the pain scores of these patients. And then it grew into an extensive study with a laboratory arm. And I think it has very useful clinical applications in terms of being simple and inexpensive, especially in a country like ours. So we hope to...
Basically, she used cold BCL to reduce pain.
Yes.
Because she just wanted to... Okay, thank you.
Thank you, sir.
We'll see you again next year because other awards are missing from here.
Thank you.
Dr. Sheetal is here, Sheetal Brar. Somebody should call her because she's again a dinosaur in this award. Can you call her? And very dear friend, Dr. Srinivas, again. See, Leslie. So, Srinivas, this is your 4th time here? 5th time, very good. Srinivas, this award, which of the 5 awards are your special? Which is your most special of those 5 awards? And why? No, you can't.
No, actually, of course, the first one came as a surprise. I didn't even know that in the gala dinner in ASRS. I was just sitting and after Dr. Navroki, who first described the inverted ILM peeling, so after his award, I got to know, I was just looking, who is this Srinivas, who are they announcing? Because I was not told before, and I don't know why I didn't receive that mail, and somehow it got missed. So in the gala dinner, that was a real surprise. But my most heart-touching one was the one which I did with the pediatric RDs. They were all the closed funnel RDs, and tried to settle it, and that touched my heart, and that was the 3rd, and this was the 5th time we did it in the Taming the Tornadoes. How the complications happen in each and everybody's life while doing the surgeries, but how we manage it and how we try to bring our patients back. Not only just on that, but I should learn from you as well, the counseling part, taking the patient on a holistic approach, not just a treatment, but giving a whole holistic approach is what. So I dedicate this to all my department and especially my colleague, Dr. Giriraj. I don't think he's there. So they are the people who work many hours, and I just do the surgery, but they are the people who try to bring it together.
But winning this award consistently to the country, and I think Aditya was also there and few others from here. I think this requires a big round of applause from all of us. This has become so synonymous with India.
Thank you, sir. Thank you so much.
Shall I ask, how many people have won 5 in a row? Any idea, statistics?
There is one.
That's another.
Lionel Raj, Pooja,
Yeah,
Sheetal.
Lionel Raj, I know, yeah.
Sheetal.
Very good.
Yes, that's why we called you.
So,
we were about to send it to satellite now.
So we'd like, after we finish, we'd like to have a picture of all these 3-4 awards.
Lionel is here, he left.
Lionel. So we'll
call him when Sir is there because they were not there.
All the Red Buckler Award winner, all 4 to stand and have a picture.
Come, Sheetal, come.
Come.
I don't.
Sheetal always.
So
what can I say? This is, I'm feeling so happy coming back to this stage after 2 years. I think the last one was in Delhi. So last year we could not attend. So thank you so much, Lalit Verma sir, Harbans Lal sir, ma'am, Rohit sir, your brainchild. So for creating this prestigious stage for all of us, it's so inspiring that it inspires me even at this age. I can see now lots of youngsters are coming. So I get so inspired, to do more work and good work and, give my best every year to come back to this stage. So truly inspirational work. Thank you so much.
Hope to see you again next year.
Hopefully.
Yeah.
Sorry. So I'd like to call upon Dr. Shruti Kochar, and she won the best award at EPOW. So Shruti, wait, where are you from now? What are you doing?
I'm from Indore. Apart from my solo practice, I also am into managing a 300-bedded super specialty hospital. So I'm going towards management.
The husband was a cardiothoracic surgeon. He's here?
No, he's not. Thank you.
Thank you, Shruti. Dr. Smith, Snehal. You were there last year also on a virtual platform. Sheetal, you should call sir also. Oh. Okay. Lots of awards, Dr. Smith. Beautiful. Yes.
So I'm grateful to my mentors, Dr. Sheetal ma'am and Dr. Shri Ganesh sir. And I would like to dedicate this award to my late father.
Smith, Snehal, would you give you said where you're working and something about your work, about the award.
Yeah, so presently I'm working at Netradama itself as a consultant for refractive. So my first award I won in a conference in Nagpur. It is awarded on the basis of international publications and previous presentations and international platform. My first prize for free paper presentation is on a technique devised by Dr. Shri Ganesh sir called femtocapsulotomy flap technique. It is a simple technique wherein the femtocapsulotomy flap is floated up and used as an endothelial protector. The first prize e-poster, another was in a refractive category. It was a comparative study on ICRL, toric, phakic IOL and star ICL that has been published in JRS. And my another poster was on pseudophakic hybrid monovision that is also published in Journal of Ophthalmology.
Fantastic. It's very nice to see winning videos and papers being published. I think this is a very important take-home point. Yes, ma'am, please. Ma'am, first thing is on behalf of everybody, our rooms are getting smaller. So
I wish I had allotted these rooms, Rohit. If I get the opportunity to, I promise you it will be the best hall.
First hall was big, now this...
Yeah, I was very much concerned. In fact,
Yeah, even I couldn't believe because it is always hall A, this.
See, if you have to give recognition to all these awardees, and I am very much concerned, Arvind, that I always, you have to keep it a grand ceremony. Because these are very prestigious award, very, very prestigious. And sometimes maybe more prestigious than whatever we are giving in AIOS. Because therefore, I label them as international heroes. Because these are the members of AIOS who have made AIOS proud, us proud, by winning abroad. And that's when I, contacted Rohit, man, Rohit, something has to be done for these heroes.
I told sir also, sir is getting really smaller.
No, I know that. I know that.
We'll make sure.
So Dr. Partha has to make sure for next year that it's a bigger hall.
Honestly, I will. You see, I got disturbed actually when I entered this hall, honestly. But I will not as anybody, I'll
Not
catch
compromise,
Partho
yeah.
because you see, either he has not paid attention or he has not realized the importance of this.
Of the session. Anyway, I think I would like to congratulate Dr. Rohit Shetty and Sir, because I know that both of them conceived this, and like Sir said, it is truly, truly a session to look forward to, and you all have done us proud all over the world globally, and 3 cheers to all of you. The hall will get bigger, and I hope a situation comes when the hall never gets filled up completely. I mean, it gets so much filled up that there are people waiting outside the hall.
Thank you, ma'am.
Okay,
Thanks a lot.
thank you.
I'd like to call upon Dr. Sneha. We have only 5 more to go. Sneha Gupta, you can bring your husband also. Come. You are a big part in her life. Dr. Sneha finished her fellowship. Now she's taken a break. Husband is, he's the vice president of Byju's, right? The academy. So he's taking care of that, and a big role in her life. And lots of good awards, ASCRS, ESCRS, and all that. Sneha, any tips for the youngsters here? And this is your first time, second time?
First time.
First time, fantastic.
First of all, I would like to thank my mentor. I would like to thank you, sir, for giving me all the opportunities. I would like to thank the entire team of NN. I would like to thank Dr. Pooja ma'am, who was always there as a support. I would like to thank all my colleagues who were always there with me. The tip that I would like to give you is just believe in yourself, believe in the work, and just keep going. You will be rewarded. Thank you.
And when she talks about it, it's not about empty philosophy. I've seen it working. And a big round of applause to you, because she used to work 7 days a week, and he was a non-complaining husband. And I think, I mean, it needs support. Otherwise, if he was nagging, then she would not work, no?
Actually, you gave me the best 2 years.
Oh. Good, all the best. See you next year. Snigdha Mishra, she's here? Where? Good. So, won the second prize at AIOS Ophthalmic Oscar for videos at, this was a virtual meet, I guess. Dr. Snigdha, where are you from? Let them finish the photograph. So where are you working? What is your area of interest?
Yes, sir. I just finished my residency, secondary DNB in Arvind Eye Hospital, Pondicherry. Just waiting for practical results there. And this video was on the landmark paper on the efficacy of intracameral moxifloxacin.
Fantastic.
Yeah. So
Have you
it's changed
submitted
into a
this
video.
to any other conferences?
Yes, I had submitted it to APVRS. It got selected, but then didn't win an award in that.
I think for the people who want to submit somewhere else, I think this is going to be a tough paper to compete. Thank you.
Thank you.
All the best. God bless. Dr. Subendu Kumar Boral. Yes, sir. So again, the best video, ASRS. Yes. Dr. Lalit Verma, sir, would you like to introduce him?
No, Shubhendu, when he was doing residency with us, he used to be very quiet and low profile. But after going to Disha, he has blossomed into a wonderful surgeon. And if you see his videos, they are no less than the best videos I have seen on the earth, actually. So wonderful job done, Shubhendu. Really proud of you.
Thank you, sir. Can I take the picture?
Yeah, picture.
So this is your second time, sir? This is your third time?
Second time. ASRS second time. Okay. Yeah, sure.
Dr. Supriya Samak. You're sure you don't want to wait for your dad? So she won the best film at the Young Producer Physician meeting at ASCRS. So Supriya, do you introduce yourself, please?
Good afternoon, everyone. I'm Dr. Supriya Samak Sri Ganesh. I'm currently working at Netradama Eye Hospital in Bangalore. My video was on the MyLoop device and how to use it, the small intricacies, the tips and tricks on how to successfully use it in an array of different types of cases, including a lot of subluxated cataracts, etc. So that's, and then we use it in practicality almost every day of our OR.
So it's the runner-up now. What is your plan to reach the best of best?
This was actually the first.
You have fantastic mentors in your place, but I want to know.
Absolutely. So this was actually a video that I made in 2019 in my first year of post-graduation. This was the first ever video that I made. So I've learned a lot since then, and I'm planning to apply it.
See you next year with the best of best. God
Thank
bless.
you, sir. Thank you so much.
Next year you will be at the top.
Dr. Tutul Chakraborty. Miss. This was the paper of the month for the Journal of Glaucoma by Advisory Board, World Glaucoma Association. Doctor, can you let us know something about this and let us know where you're from and for people?
Actually, this paper was done during my Fulbright fellowship. I got Fulbright 2019-20. This is, and I was posted in Hamilton Glaucoma Center. My mentor was Professor Linda Zangwill and Professor Robert Weinreb. When we presented this first in ARVO 2020, and this is after a long time, Hamilton Glaucoma Center got this because we were invited to, I was invited to present oral presentation for ARVO. Is a normal presentation in ARVO is poster presentation, but we got it for oral presentation. And Professor Winder was very happy that after a long time it got the oral presentation. So after that, in last year, June, I came to know that World Glaucoma Association that selected this paper as the paper of the month. So I presented the podcast because Linda wanted it. Linda told me that you are the lead author, so you should present the podcast. So I presented it, and this time I'm grateful to you that I got this recognition. Thank you very much.
Dr. V.R. Vivekanandan. Dr. Vivekanandan is here. Anybody from his institute, friend, colleagues? You are? No. Okay. Dr. Vardhaman is here? Yeah. Vardhaman inducted as a top 50 keratoconus researchers worldwide. Thank you. Still need to introduce yourself.
Yes. Thank you so much, Dr. Rohit. I'm Dr. Vardhaman Kankaria from Pune. And of course, thank you to AIOS, to Dr. Partha sir, to Dr. Namrata ma'am, Dr. Rohit, Dr. Lalit sir, to bring out this platform for all the people. So basically, the Expertscape is a meta-analytical research organization which looks at last 10 years of research papers which has been published. They look at the citations that your research papers have received in last 10 years. And they also look at a number of the impact factor of the journals that you have done. And so they come with so this last year, they have included me as one of the top 50 names. But I think more important than that is that in the same list, it is an honor for me to make the list with Dr. Rohit and Dr. Namrata also being in that top 50 list, of course. And I'm very thankful to my mentor, Professor Kimionis, who is one of the pioneering keratoconus specialist and researcher, for all the support and the guidance that he has given me in the last decade. Thank you so much. Thank you.
Which is your most interesting paper, which you feel is one which pushed you to that top 50? And because there are a lot of people who are here, some of them are working on the core areas of work, and you need to tell them how do they choose to reach that stage.
Thank you, Dr. Ed. So I think I will say probably one of the papers which are very close to my heart has received a lot of cross citations as well as has been quoted a lot in many papers, and has actually received a lot of rejections in the beginning, and we had to do a lot of work and rework on this topic, was Cretan protocol. So this was the protocol for cross-linking when we combined the transepithelial PTK along with collagen cross-linkage for patients where you cannot do a topographic added PRK for them and still improve their topographic outcomes. And I think this paper went on for review for almost a year, and after that it got published in ophthalmology journal from AIOC.
One of the highest cited. Cited what now? Some 1,000 times?
Oh, no, I don't know exact number recently, but I think this is probably my most cited paper right now.
Fantastic. Yes. And you also had a 10-year follow-up of the same paper.
Yes, now we have published recently a long-term follow-up of Cretan protocol, and now due for publication maybe in next month is Cretan Plus protocol, which is offshoot of the same protocol when we are doing a transepithelial PTK with a regular PRK for patients with keratoconus.
Fantastic.
Yes.
Thank you.
Thank you, Dr. Raj. Thank you.
The last one we had missed is Dr. Prasanna Venkatesh. Please come. Yes, he's here. Your parents are here today?
No,
they didn't. Oh, to AIOS at.
Yeah,
emergency. Okay. The Prasanna was there last year. Also, very innovative mind. Best photography of the 9th World Glaucoma E-Congress. Prasanna, would you like to introduce yourself?
Yes, sir. I'm Dr. Prasanna Venkatesh. Sorry, I'm breathless. I had my finals in CS Rishmi now. Just now it got over. So I would like to thank my mentor here, Dr. Satyan Parthasarathi, sir. I was with him for 3 years, and he was the one because of which I took glaucoma. Though I come from a ophthalmic background, though my father is not here, I don't feel that because sir is here with me. And no, my father is actually in Trichy, actually. Sir is with me. Sorry, I'm breathless. Bear with me. So my idea was, if an image speaks 1,000 words, what if we make an image moving? So that got me going, and we have recently, for the past 2 years, published 82 articles in the last 2 years, with 46 in Indian Journal of Ophthalmology, with the 2 cover images, one on January flecked retina, and the other one last July we had another autofluorescence image. And next month we are due for ophthalmology, glaucoma, and Axenfeld Rieger syndrome, which is labeled as an eye aquarium in American Academy. So I always owe my success to my mentor. And one of the pictures that got an award was in the World Glaucoma Congress. And you all must be knowing this eye model in the AIOS program book. So my interest is all about moving images, sir. What if an image speaks 1,000 words? What if we make an image moving? So that is it's a question mark, but that's my vision and mission. And we have innovated 6 innovations in our center. And those have all got this year, sir. I'll be meeting you next. We have recently got 8 ASCRS awards in the recently concluded one for photography alone. So at this moment, I would like to thank my mentor, who's also been a parent to me at this moment. Thank you. Thank you, sir. Thank you for this opportunity.
Thank you. Anybody? Thank you, sir. Thank you, Dr. Satyan. Anybody has missed this award? Because we have a list of close to 50 awards here. Anybody has missed? You want to come? Please. Sir is also. Dr. Arvind Moria's, I think the slide had only one, but he had won 6 international awards. So it's important that. Anybody else from LV Prasad? No. Come, Sheetal, bring your team. One minute. Thank you, sir. Sheetal, come. Huh? Come.